COVID-19 can be characterized as a pandemic.
You must stay at home.
We have rang the alarm bell loud and clear.
We will immediately close all shops. The way ahead is hard, and it is still true that many lives will sadly be lost.
When he announced the lockdown, it was just, oh my goodness, what happens now?
It was a day that felt like the world had left you and left you behind, but we still had patients and we still had a responsibility.
Being out in the community amongst this pandemic was surreal, and there was a lot of mixed feelings from how are we going to do this, how are we going to achieve what we need to do, how can we support our patients out there.
We were very humbled really at the self-sacrifice of the nursing staff, and one particular nurse who was very involved in the physical care of Sue and just let slip in a conversation that she was asthmatic. And I found that quite humbling really, to think that she was going to a job that was risking her own life.
I think the hardest thing through all of this was the moment we had to close to visitors. People won't know how hard this is for us to tell them that they can't come and visit their loved one.
You feel that you have to step up, you have to be everything and everybody to them, so you need to be their daughter, their mother, their nurse, their doctor, their carer.
Witnessing that suffering, witnessing the fact that families couldn't be there. So I worry about my team, I worry about the impact of the suffering that they've witnessed and how that will be on them as we come through the other side of this, whenever we do come through the other side of it.
All of our staff were very scared, a number of our staff suffered quite severely with COVID, but we sadly lost one of our staff nurses who'd worked for us for a long time, and he was an amazing man, fantastic nurse, beautiful, beautiful person. But unfortunately, he had contracted COVID, and for the team to lose a member of such a close-knit team was really difficult, yet they still turned up day in, day out to care for those patients, because that's what Mark would have wanted.
It didn't feel like the ward that we would normally have, but there was a huge sense of camaraderie, a huge sense of we're all in this together, and that we will get through it, and a determination.
I am in absolute awe of how the hospice, in such a difficult situation, pulled together in many different directions to make sure that that patient's journey was not affected, that they were getting the support that they needed.
The two focuses for the hospice during this time were this absolutely frantic focus on safety and maintaining patient care and services, but at the same time you stop and you realise that everything that has kept you going for all of those years, suddenly it stopped, and it stopped dead. The reality is we need our local community to support us if we're going to continue to be here.
Professionally, it's been the toughest leadership challenge I've ever faced. My current concern is ensuring that we just can continue to provide the high quality care that we do, and that requires our communities to continue to dig deep and support us in the way that they have.
But without the people that were running around their gardens, cycling on their turbos, I don't know what we'd have done without that money coming in. We are here today because of you, and thank you.